guys, how you doing today? Of course, I said we're going to get into a series on the different types of breast cancer. Today is number 2 in the series, which is IDC, which is Invasive Ductal Carcinoma. If you have not been here before, this is Queen Bee, and I talk most things breast cancer as a 2-time breast cancer warrior. I will talk about probably some other things that may be breast cancer related, but who knows? You never know with me. But if you've never been here before, welcome. If you have been here before, welcome back to my channel. I appreciate all of you being here. So let's get started. So all of the information I will give you today is from breastcancer.org. Since I am not, this is definitely, the stuff I get will be from breastcancer.org, the stuff that I'm telling you, because I am not an oncologist. I am in no way a professional. I'm just telling you from breastcancer.org and from my own experience. I was first diagnosed in 2012, but we will get into that later. And if you look at some of my other videos, then you'll definitely see those. I'll try to post them up here. I'm still, getting you, learning the ins and outs of this. So if it's not there, you can always go to my channel. Please, if you were there and you think that you get value out of anything I say, please feel free to subscribe. A lot of the times I do these videos is because I think a lot of people, don't want to read about what they think may be happening to them, or hearing it from somebody who has been there might make them feel a little bit better. And hopefully I can be that resource for you. IDC, which is invasive ductal carcinoma, sometimes called infiltrating ductal carcinoma, is the most common form of breast cancer, and about 80% of breast cancers are invasive ductal carcinoma. Invasive means that the cancer has invaded or spread to the surrounding breast tissue. So if you remember from the first video, if you haven't seen that, please feel free to go back and watch it. Ductal means that the cancer has begun in the milk ducts, which are pipes. You'll see, I'm going to try to put a diagram up here. We'll hope that happens, that carry milk and milk producing, from the milk producing lobules in the nipple. Carcinoma refers to any cancer that begins in the skin or other tissues that cover internal organs such as breast tissue. Over time, IDC can spread to the lymph nodes and possibly other parts of the body, which means metastasize. That's what it means when it spreads to other parts of the body. It metastasizes. So it can affect women of any age, but it's most common in women over 55. This does not mean that you're not supposed to do breast exams. It does not mean that you're not supposed to KYH, know your history. These are all very important things for you to know, so that way you yourself can know whether or not you're at risk for breast cancer, along with doing self-breast exams, which is very important, which you will hear me say that time and time again in my videos, because I have had people tell me before that they don't want to do breast exams. So now I know they have a, I know they have a certain age. Who they is, I don't know, but I would like to know that women should start getting, at what point women should start getting mammograms. Like they say, if you're over 40, which to me is totally crazy, because there's so many women who are younger than that. There's been women in their teens that have gotten breast cancer. So please start doing your getting your mammograms, doing your breast exams, regardless of your age. Because like I said, younger women in their 20s, 30s are known to have gotten breast cancer, and men too. Men, you're not exempt, so make sure you know your history too. 2/3 of the women are over 55 when diagnosed, and also affect men also. Okay, so just remember that. Find out what your history is of breast cancer. I know it might be a hard thing to talk about, but it's important. Okay, so this is going to be some of the signs and symptoms. IDC, I will just call it IDC instead of keep saying invasive ductal carcinoma. That will get really boring. May not cause any symptoms, but an x-ray or may show an abnormal area which would warrant further testing. Okay, so the first sign could be a lump or mass that you can feel, doctor can feel. I know some women who have told me they don't like to do, I don't like to do self-breast exams. But let me tell you something. You will let somebody else touch your boobs for pleasure. Isn't that correct? So maybe you should teach them how to do a self breast exam, whoever they are. And that way, if you don't want to touch your boobs and you want to let somebody else touch them, maybe they can tell you, honey, guess what? I feel something strange. Why wouldn't you want to feel your own boobs? I don't understand that. But hey, you do you. The American Cancer Society.org states that unusual in the breast that can be signs of IDCR, swelling of all or part of the breast, skin irritation or dimpling, breast pain, nipple pain or nipple turning inward. So if your nipple's turning inward, nipples belong outward. Nipples should be looking at somebody. It's just like when, you're outside and those chicks with the smaller boobs, or the ones that have whatever boobs you want to call them, and they have nipples, but they don't want to wear a bra and it gets cold and the nipples are outward. That's the way they're supposed to be. If they're inward, not a good sign. Redness, swelling, or thickening. We will definitely get into that because my second diagnosis, I had all those symptoms, okay? And I definitely want to share those with you. Wait a minute. Let me go back here. I'm getting ahead of myself. Redness, swelling, or thickening at the nipple or the breast skin. Okay. So, and also this is something that's not in here. Your breast will look like sort of like an orange peel. If you look at an orange peel, some women, I don't want you to get afraid. Some women, the pores, they look like pores. Some are very, very small. Other women, the pores might be slightly larger, which could be totally normal for your breast. However, if it's not, and even if your breasts are like that, still do self-exams. But if it's not, and you see one boob is like the smaller pores and the other one's bigger pores, and your boob's bigger and it's having some kind of pain, you need to get that checked out. Okay? All right. A nipple discharge other than breast milk. So if you're a woman of a certain age and you know darn well you can no longer have children, or you pass that age, some of us don't know what that age is. However, that's not normal. Go get your boobs checked, okay? A lump in the underarm area, which they have to do a diagnosis by either a physical exam, a mammogram, an ultrasound, a breast MRI, or a biopsy, okay? Less invasive, which would be a fine needle aspiration, inverting a very small needle in the breast, okay? Now, I know most people think, why would I want to have that done? It probably hurts. Let me tell you something. Invasive breast cancer is no joke. So take that little teeny needle now and make sure you get it checked out, because anyway, if it is something before it turns invasive, or even if you catch it in the beginning of it being invasive, even though it's still painful, just deal with it. Put on your big girl panties, your big boy underwear, and just do it. Okay? All right. If the needle biopsy cannot remove, I'm sorry, my nose is itching. This is not live TV, but it's real TV. If the needle biopsy cannot remove cells or tissue, or results are less conclusive, a more involved biopsy may be necessary, which does not necessarily mean, once again, you have cancer. My whole thing with doing these videos too is to give you the strength to know that get yourself checked out. I've been there twice. Like I said, I will tell you some stuff later on, and hopefully it'll make you feel better, because I'm the one you need to be talking to about this. Okay. All right. And don't forget, if you think you want to come back and see me again, or you know somebody else that's going through it, please tell them about my channel. Tell them to subscribe and turn on that notification bell so you know when I'm here and you can get all the good stuff from me. Okay. All right. All right. An excisional biopsy attempts to remove the entire suspicious lump of tissue. Keep in mind, these biopsies are done only to make a diagnosis. So, when you have these things done, you will get a diagnosis. Now, I can tell you something. I remember when, I am trying to think if it was my very first diagnosis in 2012. And you might hear this again. You might be in another video. Let me tell you something. This is what I'll share with you. After 2 years of chemo, the brain is fried. I know people say, oh, I walked in the room and forgot something. I used to do that too. Chemo's a totally different beast. Totally different beast. And I'm just thinking back in my brain memory. I probably already said that too, but it's quite all right. It's all right. But anywho, when I got diagnosed, I went and had I went and had not the surgery. I went and had a biopsy done. And what they do is they lay you down on this table. For those of you who have done this before, you already know. For those of you that don't, they have this table. You lay down on the table and you stick your boobs into these hole things. And then somebody goes underneath so that way they keep the breast stable. And then they go in and it just feels like a pinching or a pulling. It's nothing to cry. You don't have to ask for tissues. You don't have to say, can I take some pain medication beforehand? It's nothing like that. Yes, it's uncomfortable, but it's nothing that you're going to be like, oh, really. Anywho, after I had mine in, 2 places, which I found out the next week, but they told me it was on a Monday, and they told me that I would have the results on Friday. So Friday came and went, and in this case, no news is good news is a lie. It was not good news. So I can remember being at my job and being on my way to a meeting, and I remember walking down the hall and my phone rings, and I answer the phone, and it is the doctor who did my biopsy. And she says to me, oh, I'm so sorry that we didn't call you on Friday, but we did it in 2 places, so it took longer. And I'm thinking, didn't you know this before? Like, you knew you did it in 2 places, so all right. Anywho, and she so candidly says to me, as if I went into like Wawa to get a sandwich, and she says, something's in my eye, sorry guys, and she says, oh, you have breast cancer. Just like that. Just as if like, number 38, your sandwich is ready. That's what she said to me. And I just said, okay, do you know the stage? And I started asking all these questions because this is new to me. And I never once thought, oh my God, I have breast cancer. I'm going to die. What? I'm like, what stage is it? What do I need to do? She offered me some doctors that I could go to that she knew. Nah. If they have your bedside manner, no. I'm not interested. So anywho, she couldn't answer any of my questions. So I just left it at that. I hung up the phone, went on to my meeting. Needless to say, in my meeting, it's funny because I don't know, it depends on the kind of mindset you have. And I was never, and I can say this with conviction, even after the second diagnosis, which tried to take me out of here, I could say with conviction that I was never worried. I was not like, oh my God, I'm going to die. What's going to happen to my mom, my kids, my son, my grandson, what's going to happen? Never even dawned on me. Never even entered my head. All I kept thinking was, okay, now I got to go back to my doctor and figure this thing out. So like I said, we'll get into that another story later, which you'll probably hear it over and over. Don't skip through my videos though. I need you to watch the whole video, okay? I need you to watch the whole video and make sure you like it. Make sure you like it. I don't need you to like it. It would be nice if you liked it, but make sure you like my videos too. But yeah, so make sure. Second in the series was IDC. The next in the series is IBC. Don't ask me what that means right now. I know I have it written down somewhere. Chemo Brain is a real thing. Yes. So make sure you're here for the next video. Like I said, if you know somebody else that would be interested in knowing what we're doing here, or, just, come look at my videos and let them know I am a 2-time warrior. So it's not like I'm just here talking, thinking, trying to be something I'm not, because this is real. Yes. And if you see, you'll see my hair doing a couple of different things, because this is, I said before in a video, because sometimes I have my hair tied up, because this is called taxotere hair. Now, we'll get into that, but this is taxotere COVID hair, because I used to get my hair cut really short until COVID happened. And then I had that drug taxotere, which, your hair falls out, which your hair is going to fall out usually anyway, with most chemos. It doesn't fall out with all, but most. Mine did with both. And as you know, I used to have hair, like seriously, down here. And then I noticed now, like, I'm starting to get the whole Don King look. No shade against Don King, but I'm starting to get some kind of look. I don't know what my hair is doing. I just call it taxotere hair because my hair used to be great. It used to be really great. But listen, I'm happy to be alive. I'm happy to be here. So anyway, I'm going to go, and we're going to be in the next series, which is IBC. And we'll figure out what that is once I figure out what it is. All right, guys. All right, listen. Queen Bee loves you. And remember what I always say. Let your faith be bigger than your fear. Okay? Always remember that. I know the holidays are coming. I know things are going to be difficult for some people. I know some people are not going to be feeling great, but I need you to keep your head up. I need you to be positive. I don't want you to let any kind of negativity in, no matter how bad things seem. Because you can turn on the TV and look at negativity. You just have negativity all around you. Sometimes you have to be your own support system. That's all it is. That's all there is to it. There's nothing we can do about that. There's a lot of people that don't understand what you're going through. They think they understand, but they really don't. And that's okay. That is okay. But you have to stay strong up here, stay strong in here, and just pray a lot. Whoever you pray to, just make sure you pray a lot, okay? All right, Queen Bee loves you. Thank you so much for being here. I appreciate every one of you for watching my videos, for hanging out with me, and I will see you in the next video. Bye.